Welcome to The Explainer. Today, we're exploring a truly fascinating and honestly kind of surprising reality of modern medicine. We all rely on incredible, life-saving medications every single day. But did you know your eyes have one of the highest rates of blood flow in your entire body? Because of that, the very treatments designed to heal us can sometimes have completely unexpected side effects on our vision. We're looking at the science of ocular toxicity, basically how the systemic drugs you take can end up impacting your eyes.
Take a second and just think about it. Could the medication sitting in your medicine cabinet right now be quietly affecting your eyesight? It's a pretty wild question, right? Whether you're taking a daily pill for a chronic condition or getting specialized infusion therapy, understanding exactly how these treatments interact with your vision is absolutely crucial. So we're going to break down the science, decode the symptoms you need to watch for, and, most importantly, give you a solid roadmap to protect your eye health while managing your overall well-being.
Section 1. Medications and your eyes. How systemic drugs travel.
Okay, let's dive into this. To really understand how drug-induced eye issues happen, we've got to look at how drugs actually move through your body. When you take a systemic medication, swallowing a pill or getting an IV, that drug enters your bloodstream to fight whatever disease is going on. It is a systemic journey, meaning it goes everywhere. But your eyes, they're incredibly complex. They're packed with this rich network of tiny blood vessels and super delicate tissues, like the retina and the cornea. And since these drugs are traveling everywhere, your eyes often become this totally unintended target. The medication doesn't know the difference between the tissue it's supposed to heal and the delicate layers of your eye, which can unfortunately lead to buildup or inflammatory reactions.
Section 2. Spotting the warning signs, physical symptoms to watch for.
Right, let's step away from the heavy medical jargon for a second and talk about what you might actually feel. What are the specific physical warning signs? Well, we can group these into a few really simple buckets so you know exactly what to look out for. First up, visual distortions. This means stuff like a painless blurring right in the center of your vision, noticing that colors look a bit different, or suddenly having a hard time reading. Next, we've got structural discomfort. That's when you actually feel a painful pressure building up inside your eye. And finally, surface irritation. Things like a really severe sensitivity to light, which doctors call photophobia, or just unexplained eye redness. Knowing these buckets is super helpful for spotting issues early.
Now, it's super important to understand that ocular toxicity doesn't always just happen overnight. It is a highly variable process. Let's look at a timeline. Some drugs, like topiramate, which is a really common migraine medication, can cause painful eye pressure from fluid buildup within just a couple of weeks of starting it. Then you have other treatments, like immune therapies used for cancer, that might not trigger severe inflammation until maybe 3 to 6 months down the line. And then there are drugs like hydroxychloroquine, used for autoimmune diseases. Those are dose-dependent, meaning the risk builds up over time, and they might only start affecting your retina after 5, maybe even 20 years of use. So yeah, it can really happen at any stage of treatment.
Section 3. Cancer therapies and vision. The unique impact of targeted treatments.
Now, what's really interesting here is how modern cancer treatments work. And to understand the side effects, I want you to think of a normal, healthy immune system as having built-in car brakes. These brakes are absolutely vital because they stop the body from attacking itself and causing wild, out-of-control inflammation. But cancer cells are sneaky, right? They actually learn to hijack those brakes so they can hide from your immune system. Enter this incredible new class of drugs called immune checkpoint inhibitors. These drugs literally cut the brakes on the immune system so it can aggressively go after the cancer. But, and here's the catch, because the brakes are totally off, that hyperactive immune system can accidentally start attacking healthy tissue too. And yes, that includes the eyes.
This kind of hyperactive immune response most commonly leads to something called uveitis. Uveitis is basically just drug-induced inflammation inside the eye. Up to 6% of patients on these immune therapies might actually develop this, usually right around that 3 to 6 month mark after starting treatment. It's a pretty intense inflammatory response, and you'd feel it as light sensitivity, redness, and pain in both eyes. But hey, the good news? It is highly reversible. Patients often see a really gratifying, quick recovery of their vision once they get treated with topical steroid drops.
It's not just immune therapies, though. Other targeted cancer drugs, specifically ones doctors called MEK and BRAF inhibitors, well, they have their own totally unique mechanisms. Instead of general inflammation, these specific therapies can actually cause fluid to suddenly collect right under the neurosensory retina. And that results in a profound, sometimes pretty severe drop in vision, often showing up as mild to moderate blurring. But again, don't panic. These reactions are very frequently self-limiting,
or they're highly reversible as long as you've got careful medical management in place.
Section 4. What you should do, your immediate action plan.
Listen, if you take away absolutely anything from this explainer today, please let it be this clinical protocol. If you're on a systemic medication and you happen to notice any of those warning signs we talked about, here is your exact step-by-step action plan. Step 1, jot down the specific symptom you're feeling. Is it blurry? Is it painful? Write it down. Step 2, and this is so incredibly important, do not stop taking your medication cold turkey. Just don't do it. Step 3, get on the phone and immediately contact the doctor who prescribed the drug. That could be your GP, your rheumatologist, or your oncologist. And finally, Step 4, get in to see an eye specialist, an ophthalmologist, for a thorough, dilated exam. You have so much power in this situation, and following these steps is exactly how you stay safe.
So, the crucial point here, the big so what, is this. Stopping a life-saving autoimmune or cancer drug without a doctor's guidance is almost always way more dangerous than the actual eye symptom you're dealing with. Managing your primary disease has to take priority. Think about it. Suddenly stopping an immune checkpoint inhibitor or a strong lupus medication could trigger a massive, severe flare-up of the disease itself. Any changes to your dosage or switching treatments absolutely must be carefully orchestrated by your medical team.
Section 5. Your doctor discussion checklist. Empowering your medical conversations.
Let's make this super practical. Here's a take-home tool you can actually use at your next appointment. This checklist outlines some simple actions that perfectly mirror the clinical protocols your doctors are already using. First, definitely ask for a baseline eye exam before you even start a new, high-risk medication. You really need that before picture so you have something to compare it to later. Second, talk about your current dosages. As we learned earlier, drugs like hydroxychloroquine are dose-dependent, meaning the risk cumulatively builds up over the years. And third, coordinate your specialist care. You've got to make sure your eye doctor is actually talking directly to your prescribing physician so they can manage your care together safely.
As one clinical expert perfectly put it when talking about dealing with toxicities from life-saving drugs, this has to be a decision made together because it's noted to have survival benefit. It really is a delicate give and take. If a medication is literally saving your life or keeping a severe condition at bay, your doctors are going to work together as a team. The goal is to treat that eye inflammation, while ideally keeping you right on the medication you need to survive. It's all about communication.
Taking proactive control of your eye health really just means treating your eye doctor like a core member of your broader medical team. So the next time you open up that medicine cabinet, ask yourself, are you keeping an eye on how your medications are keeping an eye on you? Be vigilant, keep those lines of communication wide open, and make sure your doctors are talking to each other. Thanks so much for joining me on The Explainer today. Stay curious and stay